Hey, Dr. Lindsey and Wendy here. This is a tougher case. We've been doing videos all day today, and some of them are really easy cases, and some of them are home runs, you know, you're going to get before it. And this is a tough one. This is a younger guy who's plagued by a limited amount of curly yet fine brown donor hair and a lot of bald, real white scalp, and not much patience. He's an impatient fellow. And so he came in and looked like this and when we first saw him, and he travels for, I think he used to do something for the government, and he traveled, and so we did him, and then he took off, and then he came in, I think at 4 months, which is way earlier than I like to do him. We did a second little case on him, and then we didn't hear from him. He was never coming back to the US, and then he just popped in and did this video. So the last time I saw you was a little over 2 years ago. And can I use your face or not?
Sure.
Okay, and so I'll put up to your right in this video where we started, and we kind of pushed the envelope on you because you were young and traveling. I remember one time you said you were never coming back to the US, and so we did you, and then we did you again at like 4 months or something. So you're a couple of years out from when I saw you, and I didn't even recognize you. I think you look really quite good now. The issue is you've got a limited amount of fine hair, which we knew when we started, but now your face is framed. Have you been reasonably satisfied there?
Very satisfied.
Yeah. And again, perfection's the enemy of good. I just told you I think we can probably get another 800 to 1,000 grafts and add to your hairline, and then there's a little spot or so behind your hairline. But by and large, with your experience here, were we up front with you? Any surprises?
No, very professional, very happy with the results. And
I think we did you one time and you left and went to the Mideast right after that in the heat and everything. You didn't have any trouble, right?
Yeah, no problems.
Okay, anything else you want to add to anybody that's looking at this?
No, just say that it's totally worth it.
Okay.
Yeah.
All right, man. Thank you so much. So he looks good. I mean, he still looks like a guy with fine hair, but now instead of looking like the bald guy, between us, he looks like a guy that looks like a tough guy.
Yes. Yeah.
Yeah.
So his face looks framed, and you know, people would say, "Oh, that's thin hair," but that's all he has. If you were to look, he has almost see-through hair on the back. I think we got, I don't know, I think our first case with him, I think it was like 2,000 or 2,200 grafts.
22 and 15, and that's all he's got to
and
work
that's
with.
Exactly. So you know, it's like normally with a good donor area, one strip we can get 31, 35, you know, 31 to 3,500 grafts. But with him, I mean, it was...
Yeah, so he's a tough guy.
Yeah.
And then the other thing that I'd like to mention is that he saw somebody else, and they recommended taking that limited amount of hair that he has and sprinkling it a little bit all over his head.
Yeah, but
that'd have been a disaster.
So can you imagine? So this is a good example of guys that come in here and they have thinning hair, right? Just like this guy has super thin hair, and we tell him, it's like, oh, you're not going to be able to cover. We can only fix the front because you have limited amount of hair. So if you can see, so at the end, how many grafts does he have in his head?
Well, he didn't have that many.
I know, but with the first case and the little second one.
So we've done 35 or 36.
Like 3,500. Okay, so just imagine 3,500 with fine hair, packed, how it looks. But 3,500, if we were to like put it from here all the way to where he's balding, he will still look bald.
Yeah. And right? Yeah. So we hear this every doggone day. If you don't have enough hair to fix everything, don't try to fix everything.
Yeah, don't try. So this is this is a good example. What 35 looks on a very, very thin.
Yeah.
You know, like almost.
And he looks good. And he's happy, and he's
happy.
Out there.
Yeah.
Active with the females now, and got confidence, and it's a job well done for him.
Yes.
So if we can help you, please give us a call. Thanks.